Hi, it's a real pleasure to be here with you today. Our paper, Normalcy in Healthcare Design, an extension of the natural and built environment, explores the benefits of healing gardens using the recently completed Lady Salanto Children's Hospital in Brisbane, Australia, as a case study. This presentation provides a short background to the Lady Salanto project, an insight into our research journey to date, our research approach and methods, key findings and next steps. The Lady Salanto was a once-in-a-lifetime brief requesting a single children's hospital in Brisbane, the subtropical capital of Australia. The new hospital was to be designed to world's best practice, bringing together specialist services from two hospitals to a single location. The project's vision was for a holistic approach to health and well-being, challenging the traditional notion of hospital and adjusting the focus from sickness to health. The vision was to deliver a facility that heals the body and the mind, created through the process of evidence-based design and patient-centered care. The outcome is an urban hospital which provides easy access to fresh air, sunshine, stunning views, and a good dose of nature. The Lady Salanto maximizes green with only 23% of the site area covered by a conventional roof, with the remainder of the site being public open space and roof gardens. The Lady Salanto Children's Hospital is designed to reduce stress and anxiety and includes a community plaza and 11 healing gardens, catering for the needs of patients, their families and staff. The philosophical underpinnings for the Lady Salanto healing gardens are the power of nature and the benefits of contextual design. Both are fundamental to health and well-being. Many factors contributed to the successful integrated design at the award-winning Lady Salanto Children's Hospital, including the early engagement of landscape architects, a collaborative project team, a committed client, and clearly defined design drivers. I am a practicing landscape architect, and my personal research journey has been fortuitous. And a couple of years ago, I could have not imagined being here presenting at an international healthcare design conference. The journey wasn't easy. Indeed, it was a bumpy ride with many forks in the road. Challenges included, how do you do an abstract or a conference paper? How do you distill the 7-year Lady Salanto Healing Garden journey into a 15-minute presentation? And how do you conduct, analyze, and evaluate user feedback? I have been fortunate indeed, meeting like-minded academics who are fun and share their experience so we can collaborate and develop our ideas freely. My first International Design and Health Conference in Hong Kong in 2015 proved to be an eye-opener. A wealth of research knowledge was presented. However, very little application of this scholarly work. How can this be? It is our aim to bring together theory and practice, and in collaboration achieve innovative design outcomes. We are well underway, and the outcome of and interest in our research journey has been incredible.
When Katharina approached us, we realized their design approach and our research agenda had many overlaps. This made us really interested to work together. When we explored this synergy further, we identified 4 main theories and/or philosophies that guided the design of the gardens, making the Lady Salanto Gardens a fascinating case study to explore, and my team was really excited for this opportunity. Now we have a fantastic context for what biophilia is, thanks to the previous presenter. The gardens were designed with the understanding of the biophilia philosophy, which states that humans crave natural settings due to our evolutionary development. Now, when we look at this in terms of health and well-being, salutogenic design emphasizes the need for design that promotes health and wellness. Salutogenesis seeks health-promoting design that reduces cortisol levels and provides a context to heal. The Lady Salanto vision considered contextual design by appreciating the needs and preferences of the users of the space, and thus really taking into consideration the context. For instance, the team considered Brisbane's unique characteristics and chose to celebrate Brisbane's subtropical climate and lifestyle. Family-centered design This is really important since this is a children's hospital. In general, this hospital was designed to not look or feel like a hospital. This became our theoretical framework and the lens through which we explored our collaborative research. With this in mind, we started to have conversations with Professor Jenny Ziviani from the Children's Research Center. We know that hospitals can be very stressful for patients, families, and even staff. We started to talk about different tactics used in therapy and in design to help reduce stressful hospital experiences. Currently, we understand that allowing patients to feel normal assists in therapy by engaging children in normalizing activities to divert their attention, allow them to feel more at ease, and thus respond to therapy better. We started to think, well, how can gardens and open spaces offer this sense of normalcy and provide opportunities to engage and experience familiar activities, such as seeing a gardener maintain a garden, experiencing the smell of freshly cut grass, children being able to play outside, or staff members having lunch with colleagues in what could feel like a park. We wanted to know how this concept can be applied and what it means for healthcare design. The team ran a workshop to develop the research methodology for the research project. The outcome was a quantitative-qualitative approach consisting of a 4-part collection approach, including semi-structured interviews, bench diaries, online survey, and environmental monitoring sensors. Through the semi-structured interviews and the bench diaries, we were able to collect interesting data on how people are responding to the gardens in the Lady Salento Children's Hospital. The other 2 research methods, survey and environmental monitoring sensors, are part of a larger year-long research project that is due to be completed in July 2017. For the purpose of this presentation, we will focus on the data from the first 2 research methods and how it informs the role of green spaces in creating normalcy in healthcare design. A series of 12 semi-structured interviews with allied health practitioners highlighted how the gardens offer patients as well as their families a space to escape the hospital environment, which can often feel sterile and disconnected, and instead offer them a sense of connection and normalcy. Interestingly, interview participants also expressed the ease it provided patients and how this facilitated the therapy session to run smoothly. They understood that children do not want to be in a hospital. These gardens physically remove them from a hospital environment, and for a moment, they're able to feel like children again. This was also essential in accelerating healing rates and responsiveness to therapy. The second method, bench diaries, was an incredible experience as it gave us amazing, unbiased reflections of occupants' experiences of the gardens. Bench diaries were left on seats over several weeks. This exercise was a replication of previous bench diary study undertaken in 2015. This paper is now published, and if you're interested, we'd be happy to provide you with a copy after our presentation. The diary entry on the right highlights a fascination with feeling as though we weren't at a hospital. This entry, written by a child visiting the hospital with their mother, serves as an important insight into how the gardens can in fact play a role in perpetuating this notion of normalcy in a hospital environment. This diary entry on the left showcases a family's feeling of being connected to the surrounding environment, which again can offer a sense of familiarity within a hospital setting.
To date, we have identified 6 emerging design principles based on the data collected, the literature, design philosophies, theories, examined healthcare models, and learnings from the design and implementation of the Lady Salento Children's Hospital. These emerging principles of normalcy in healthcare design represent an evolving framework which we intend to test on a number of existing international and hospital designs. We actively encourage open discussion within the healthcare sector to contribute in the conversation and development of the design principles and tools for practical application. This will help in normalizing the look and feel of healthcare facilities for patients, their families, and staff.
Now we will talk about each of the design principles. The first principle, considering location and context, is important to seamlessly integrate with the surrounding environment to reduce stress for patients, their families, and staff.
The healing gardens and community spaces at the Lady Salento take advantage of Brisbane's subtropical character, benign climate and popular outdoor lifestyle. The community plaza in front of the hospital is a busy place and brings together people from the Lady Salento, adjacent schools, research facilities and the Mater Hospital. The transplanted fig trees, which are already 30 years old, promote a green, shady canopy for the gatherings, markets, performances and social events. A small amphitheatre, partly located under the building and adjacent to the children's playground, is frequently used during the day, and it is a popular spot to have lunch, meet friends or merely relax and observe the world go by.
The second principle points out the benefits of co-locating internal and external hospital programs to provide options for hospital sessions such as rehab and therapy.
At the Lady Salento, the co-location of hospital functions from inside to outside has made it possible to extend internal hospital programs to the rooftop terraces. For example, the Adventure Garden on level 6 allows for rehabilitation activities complementary to internal rehabilitation facilities and includes a climbing wall, a basketball hoop and a wheelchair training ramp. Rehabilitation facilities are designed to improve coordination, build strength and above all, provide hope for the future.
The third principle, prospect and refuge, suggests the need for landscape settings to be open and inviting to help occupants de-stress and recuperate.
The landscape setting at the Lady Salentos are designed to be open and inviting with opportunities for safe observation. This applies British geographer J. Appleton's theory of prospect and refuge. This theory argues that an open landscape with opportunities for concealment as well as prospect is most beneficial to people's survival and in our case for enjoyment and use.
The fourth principle emphasizes the importance to provide adequate green space for therapy, rehab, and for occupants to comfortably enjoy the gardens.
The design concept for the Hospital of Urban Park encapsulates the design intent and integration of building and landscape in the design. The outcome is an urban hospital which provides easy access to fresh air and sunshine, stunning views and a good dose of nature. The Lady Salento maximizes green with only 23% of the site area covered by conventional roof. The remaining 77% is public open space or roof gardens. This was achieved by stepping back the facade of the building to provide the platforms for the roof gardens. From our observations, the Secret Garden on level 5, which is accessible to the general public, is the most popular garden in the hospital, likely due to its character, accessibility, orientation and aspect.
As mentioned earlier, biophilia recognizes our innate need for nature and natural things. The fifth principle recognizes that humans evolved in nature and subconsciously crave it and desire it, which in turn stimulates our senses in a reassuring way. The
Child Youth Mental Health Services Garden, or KIMS gardens as they're generally referred to, are specifically designed for young children, adolescents and high care patients. They're designed to help lift the spirit, calm the mind and gently stimulate the senses. The KIMS gardens offer a range of activities and uses which include a paediatric garden, a kitchen garden with fresh herbs, outdoor gymnasium, barbecue garden and an adolescent garden. The sixth and last principle is about catering for a variety of activities by providing comfortable places for socializing, therapy activities, family gatherings and staff events. Outdoor spaces at the Lady Salento were purposely designed for different age groups and activities, such as recreation, rehabilitation, and therapy. Outdoor spaces are designed to reduce stress and anxiety and provide distraction and relief. For example, the children's playground can be monitored from the hospital cafe and therefore enables parents and children to relax in an environment that caters for both the children's and parents' needs. Staff retention and staff satisfaction are a high priority at the hospital. The staff garden on level 7 is available to doctors, nurses and administrative staff. The staff garden is located complementary to internal recreation spaces. This allows staff to escape from an often stressful environment to a dedicated garden to relax and disconnect from work.
From what we heard yesterday and today, people greatly value healthcare, and we can see that healthcare spending is readily increasing, which means we need to be innovative and strategic with healthcare investment. In order to achieve this, decisions and design need to be underpinned by evidence-based design. For this reason, our research agenda focuses on capturing end-user experience, similar to what we talked about today, and quantifying the cost-benefit analysis of healing gardens in a hospital setting, and engaging with allied health practitioners to conduct therapy studies that explore the difference in patient progress with and without garden exposure. This research agenda will provide us with much needed in-depth understanding of the economic, environmental, and social performance of gardens and hospitals, a gap that academics and industry are currently hoping to address.
In conclusion, healing gardens play a critical role in patient care and staff well-being. Our research agenda is also expanding from hospitals to green infrastructure and the built environment. We actively seek to engage globally with healthcare and design professionals to work towards achieving our ultimate goal. Our ultimate goal is to provide better quality lives for humanity on planet Earth. We would like to acknowledge our co-authors, Professor Ziviani, Children's Allied Health, Associate Professor Cheryl Desha, School of Engineering and Cities Research Institute, Griffith University, and Dr. Angela Reeve, Visiting Researcher, Queensland University of Technology. We would also like to acknowledge Lady Cilento staff, patients, and their families.